Good day, I am Dr. Navid Roodaki from the Department of Pediatrics and also a member of the Hospital Research Unit, and I was tasked to discuss the different types of research design in health research. So for today, the discussion would be divided into two parts. The first part, we would be discussing observational analytical studies and experimental studies, followed by qualitative and mixed method designs. For today's discussion, it will be divided into two parts. The first part discussing the analytical observational studies and experimental studies, while the second part will discuss these qualitative studies and mixed method studies. Take note that the second part will only be an introduction on qualitative studies and mixed method studies. To begin with part 1, we will first define what are observational studies. Observational studies determine association between risk factors and outcomes. It is called a descriptive type of study when it focuses on the pattern and frequency of disease according to person, time, and place. While analytical type of studies, which uses inferential statistics or determined inference, assesses the determinants and risk factor which might be associated with the disease of interest. Interventional studies determine the association between intervention and outcomes. This includes experimental studies such as clinical trials. Now, the different types of observational analytical studies include cross-sectional, case control, and cohort. Again, this discussion will focus on analytical studies that are most commonly utilized in healthcare research, especially among residents. First is the cross-sectional study design. It determines disease burden and or association between exposure and disease at a single point in time. As shown is the figurative description of a cross-sectional study compared to a longitudinal study. Take note that in cross-sectional study, the study population is selected from a single target population as shown in this slide without regard to exposure or disease status, which means it only shows a snapshot and is non-directional. Prevalence of the exposure and outcome is determined at the same time. This is another representation of a cross-sectional study. Take note that it can be used to determine disease burden and possible exposure, again taken at a single point in time. In cross-sectional studies, you don't influence the outcome. Cross-sectional studies can be analyzed using 2x2 table as shown with the outcome of interest cross-tabulated with the exposure. Prevalence ratio is primarily used in cross-sectional study. This is the ratio of those with the disease among those not exposed, as shown in the slide. We are talking about exposure, which will be determined by the rows in the 2x2 table. Let us see this example. A study tried to determine if smoking is a factor in developing COPD. Here we can see a 2x2 table where the following values are placed. We have 35 exposed and 65 unexposed. Substituting it to the formula given, we will have a value of 3.6. So if interpreted, that smokers are 3.6 times more likely to have COPD than non-smokers. The advantage and the disadvantage of cross-sectional design are as follows. It is quick and inexpensive to conduct. It is useful for describing characteristics of the target population. Many outcomes and exposure can be assessed. Useful for hypothesis generation. Can provide estimates of disease and exposure. Prevalence in addition to the association. Disadvantages include it may be difficult to establish temporal relationship and it is prone to selection bias. Now let's go to case control study design. Case control studies examine exposure-disease relationship by enrolling cases, those with the disease, and control, those without the disease, and then comparing exposure history. Here is a representation of a case control study. Please take note that it is a retrospective type of study. So when writing your research protocol, there is no need to mention that it is a retrospective study. Here, you have cases or the disease of interest and the control, which are usually healthy individual, matched with the characteristics of your cases. Selection of cases, also known as case definition, is based on the set inclusion criteria. Remember that the inclusion criteria is not the opposite of the exclusion criteria. Rather, the exclusions are those criteria that you would like to further exclude among those included. One factor that is important in case control studies is the selection of controls. It should be from the same study base as of the cases, should be representative of reference population from which cases are selected, or it is comparable. They should have the potential to become cases. They have to be susceptible for the disease of interest. Another factor to consider when performing a case control study is matching cases with control. It is the process by which we select control in such a way that they are like cases based on certain variables. These are variables known to influence the outcome or disease, and which, if not adequately matched or comparability, it could distort or confound the results, as represented by the following icon. All cases and controls should match depending on the set inclusions. How many controls for each cases? The most optimum case to control ratio is 1:1 to 1:4. More than that, it will no longer increase the statistical power. The statistical power is determined by the statistician who would compute your sample size. It is usually set at 80. The advantages of a case control study: it is faster, inexpensive, it is time effective, good for rare cases, diseases with long latent period, can study multiple exposures. Disadvantages include: it is not useful to study rare exposures, can calculate incidence, not useful to study multiple outcomes, subject to selection and recall bias, selecting appropriate control can be challenging. Now, let's go to the analysis of case control study. But first, let's know the difference between probability and proportion. Probability or odds represent the chances of some events happening, while proportion summarizes how frequently some events actually happen. For case control studies, we use odds ratio. Number of ways an event can occur relatively to the number of ways an event cannot occur. As shown, it is computed as follows: odds of case being exposed to odds of control being exposed. Now, substituting it or using the 2x2 table, we will end up with the following equation. Now, it is AD over BC. So here is a hypothetical data from a research that determined the odds of developing necrotizing enterocolitis among preterm infants. Using the formula and substituting the data presented in this slide, we would come up to the value which is 1.74. Now, let's interpret it. It is interpreted as those born prematurely or premature are 1.74 times more likely to have NEC or necrotizing enterocolitis than those born full term. Now, let's go to cohort study. It determines exposure-disease relationship by enrolling individuals without the disease, assembling them by their exposure, and following over time for disease occurrence. It compares those who are exposed to the risk factors with others who are not exposed to the risk factors or exposure. It is known to be the best observational study to observe disease. May be prospective or retrospective. This is a graphical representation of a cohort study. Take note that this is a representation of a prospective type of cohort study. For the advantages, it can establish cause-effect, can study more than one disease related to single exposure, good when exposure is rare, can find out incidence rate and risk, minimizes selection and information bias, inexpensive, long time to complete. For its disadvantages, it is expensive, it is long time to complete, especially for the prospective type, not good for rare diseases. It is also not good for diseases with long latency. There are a lot of loss to follow up, often requires large sample. So the analysis of cohort studies, they usually use the relative risk. As shown again in this slide, the relative risk is computed or determined by determining the incidence exposed over the incidence unexposed. Or if you substitute using the 2x2 table, you'll have A over A plus B divided by C over C plus D. So the one of the most famous cohort study is the Framingham study. Up until now, it's still ongoing, and shown in the screen are the different discoveries or the findings of the study over time. Now, let's go to experimental study design. Again, shown in your screen is a representation of a experimental design. There are different types of experimental studies. We have randomized controlled trials, field trials or preventive trials, community trials, and other new study designs such as the stem wedge clinical trials. But I think randomized controlled trials is the most famous among these different study designs. So, clinical trials, there is a presence of an intervention and there is an observation of the effect. It is best reserved for relatively mature research question and experienced researchers. Here is a figurative representation of a clinical trial. It entails a treatment and a placebo group. However, at present, placebo is not that ethically accepted for most trials. That is why they're using the standard of care. Placebo is only used when there is no standard of care available. All experimental studies are prospective, hence it is not necessary to mention this in your protocol. There are different phases of a clinical trial. There's preclinical, which studies the drug in cell cultures and animal, followed by phase 1, which determines primarily the safety, phase 2, the tolerability and the intensity of doses, phase 3, effect of the therapy on clinical outcomes, and phase 4, which is post-marketing surveillance. So field trials or preventive trials, they're usually interventions being applied in the community level such as family planning, treating STIs, and even giving micronutrients to malnourished children. Some other topics being used in this type of study designs are vaccine effectiveness or efficacy, nutritional intervention, maternal and neonatal intervention, education, and behavioral change. So that ends part 1 of our discussion. So we have discussed the different types of analytical observational study design and experimental studies, which includes their advantages and disadvantages and proper way to analyze them using the 2x2 table.